Have you ever considered the challenges healthcare professionals face when dealing with combative patients? It's a question that many might not have pondered, but it's a reality that those in the healthcare field grapple with daily. Combativeness in patients is a multifaceted issue that can stem from a variety of sources. It's not simply a case of a patient being difficult or uncooperative. In many instances, this behavior is the result of underlying medical conditions, mental health disorders, or adverse reactions to medications. Let's dive a little deeper. Certain medical conditions, such as brain injuries or infections, can lead to changes in a patient's behavior. They may become confused, agitated, or even aggressive. Similarly, mental health disorders like dementia, bipolar disorder, and schizophrenia can also lead to combativeness. It's crucial to understand that these patients are not behaving this way out of choice. Their condition is driving their actions. Now let's talk about medications. Yes, the very treatments meant to help patients can sometimes lead to combativeness. This is especially true with certain classes of drugs, such as steroids, antipsychotics, and some types of painkillers. These medications can cause a range of side effects, including agitation and aggression. It's a delicate balancing act for healthcare professionals, who must manage these side effects while ensuring the patient receives the necessary treatment. And let's not forget the impact of environmental factors. A busy, noisy hospital ward can be overwhelming for any patient, let alone one who is already feeling unwell or anxious. This can exacerbate combative behavior, creating a challenging situation for both the patient and the healthcare professionals. So why is it important to understand the causes of combativeness in patients? Well, by understanding the root causes, healthcare professionals can develop strategies to manage this behavior. They can adjust treatment plans, modify the patient's environment, and employ de-escalation techniques to keep both the patient and themselves safe. Understanding combativeness in patients is the first step towards managing it effectively. And that's what we're all about here: understanding, managing, and ultimately, improving patient care. Consider a case of an elderly patient who suddenly became combative due to delirium. This is not an uncommon scenario in healthcare settings, and it presents a unique set of challenges for healthcare professionals. Let's delve into the story of Mrs. Brown, an 80-year-old woman who was admitted to the hospital with a urinary tract infection. She was known to be a gentle and cooperative person, but one evening she became agitated, confused, and combative. The sudden change in her behavior was perplexing and distressing for the healthcare team. Delirium, a severe and fluctuating disturbance in mental function, was the culprit behind Mrs. Brown's sudden combativeness. It often presents as a sudden change in behavior, with symptoms such as restlessness, agitation, or even aggression. It's particularly common in older adults who are hospitalized, with factors such as underlying infection, medications, or simply the unfamiliar environment of the hospital contributing to its onset. Managing Mrs. Brown's behavior was an uphill battle. The healthcare team had to ensure her safety and those around her, but they also needed to identify and address the underlying cause of her delirium. This is where the complexity of managing such cases comes into play. It's not just about managing the visible symptoms, it's about unraveling the hidden causes. In Mrs. Brown's case, it was her urinary tract infection that triggered her delirium. Once that was treated, her mental state improved significantly. However, it was a process that required patience, empathy, and a deep understanding of the nature of delirium. Dealing with delirium and the resulting combativeness is a delicate task. It requires a holistic approach that encompasses medical, psychological, and environmental factors. It's about understanding that the combative behavior is not willful, but a manifestation of the patient's distress. This case illustrates the complexity of managing combative behavior in patients with delirium. It underscores the importance of early detection and treatment of underlying causes, as well as the need for healthcare professionals to be equipped with the skills and knowledge to handle such challenging situations. Now, imagine a scenario where a patient with a psychiatric disorder becomes combative. Let's delve into a real-life case study of a patient we'll refer to as John. John is a 40-year-old man with a history of bipolar disorder, who was admitted to a psychiatric ward during a manic episode. During these episodes, John often becomes irritable and aggressive, posing a unique set of challenges for the healthcare professionals caring for him. John's situation is not uncommon. Patients with psychiatric disorders often exhibit a wide range of behaviors, from anxiety and depression to delusions and aggression, all of which can contribute to combativeness. This unpredictability can make managing these patients particularly challenging. In John's case, his care team implemented several strategies to manage his combative behavior. First, they prioritized understanding John's triggers. They observed that John's aggression often flared up when he felt unheard or misunderstood, so they made a concerted effort to actively listen to his concerns and validate his feelings. Second, they used de-escalation techniques. When John became combative, they would speak in a calm, reassuring tone, maintain a safe distance, and use open body language to communicate non-threatening intentions. These techniques helped to diffuse potentially volatile situations. Third, they tailored John's treatment plan to address his specific needs. This included adjusting his medication regimen to better manage his manic episodes and incorporating cognitive behavioral therapy to help him develop healthier coping mechanisms. Lastly, the team maintained a strong support network for John. They ensured that he had regular contact with his family and friends, as well as access to support groups and community resources. These strategies, while not always perfect, played a crucial role in managing John's combativeness and improving his overall mental health. They highlight the importance of a holistic, individualized approach when caring for patients with psychiatric disorders. As this case shows, psychiatric disorders can significantly contribute to combativeness in patients. But with the right strategies and a dedicated care team, these challenges can be successfully managed, leading to better outcomes for patients like John. What about a case where a patient becomes combative due to a reaction to medication? Let's discuss a real-life scenario that took place in a hospital setting. Picture this. A middle-aged man, let's call him John, had been admitted for a routine surgery. Post-surgery, he was prescribed a cocktail of medications to manage his pain and aid in his recovery. All seemed well until one night, when nurses found John in a state of extreme agitation. John had become uncharacteristically aggressive, attempting to leave his bed, refusing to cooperate with the nursing staff, and even becoming physically combative. It was clear that something was off. This was not the John the staff had come to know in the previous days. The medical team was quick to respond. First and foremost, they prioritized the safety of John and those around him. They attempted non-pharmacological interventions, such as trying to calm him down verbally and creating a quiet and soothing environment. However, when these efforts failed to bring John back to his usual state, they turned to their next best tool, a thorough review of his medication regimen. The healthcare team discovered that one of the drugs John was taking had a known side effect of causing agitation and combativeness in some patients. They immediately consulted with the prescribing physician, who agreed to adjust the medication in question. Meanwhile, they continued to monitor John closely, ensuring his safety and the safety of those around him. Gradually, as the drug was phased out of his system, John's combativeness subsided. He returned to his normal, cooperative self, much to the relief of everyone involved. This case underscores the unpredictable nature of drug reactions and the importance of being prepared to manage them. In this scenario, the healthcare team's swift response, their comprehensive understanding of the potential side effects of medications, and their readiness to adjust the treatment plan were key in quickly bringing the situation under control. It's a reminder to all healthcare professionals of the importance of continually updating their knowledge and being vigilant when monitoring their patients. This case highlights the importance of closely monitoring patients for adverse reactions to medications. So how can healthcare professionals effectively manage combativeness in patients? Well, there are several strategies to consider, but let's start with de-escalation techniques. These are ways to reduce the intensity of a patient's aggressive or violent behavior. It's all about maintaining calm, showing empathy, and keeping the environment safe. A successful de-escalation can often be achieved by using a soft, low tone of voice and adopting non-threatening body language. The goal here is to help the patient regain control of their emotions, thus reducing the risk of harm to themselves and others. Next, let's talk about therapeutic communication. This involves using specific strategies to encourage patients to express themselves and to understand their feelings and behaviors. Active listening is crucial here. By showing genuine interest in what the patient is saying, healthcare professionals can build trust and rapport. It's also important to validate the patient's feelings, even if their perceptions may seem distorted. Remember, their feelings are real to them. Now, let's move on to the use of medications. Sometimes, despite our best efforts at de-escalation and therapeutic communication, medication may be necessary to manage combativeness. The use of medication should always be considered a last resort and used in the least amount necessary to ensure patient and staff safety. It's important to remember that medication should never be used as a form of punishment, but rather as a means to help the patient regain control. Lastly, let's not forget the importance of self-care for healthcare professionals. Managing combativeness can be stressful, and it's crucial to take steps to manage your own stress and prevent burnout. This could include activities like regular exercise, maintaining a healthy diet, and ensuring you have a good support network in place. With the right strategies, healthcare professionals can effectively manage combativeness in patients. But how important is training and support for healthcare professionals in managing combativeness in patients? Well, to put it simply, it's of paramount importance. In fact, it's as crucial as the medical knowledge itself. Dealing with combative patients is not just about understanding the cause behind their aggression or the right medication to calm them down. It's also about having the right training and support system to manage these situations effectively and safely. Let's start with training. Simulation training, for instance, provides a safe environment for healthcare professionals to practice their responses to combative situations. It's like a dress rehearsal for the real thing. In these simulations, professionals can learn how to de-escalate situations, protect themselves and others, and use restraint techniques if necessary. They can make mistakes, learn from them, and improve their skills without any real-world consequences. But training alone is not enough. Healthcare professionals also need robust support systems in place. This ensures that they're not just physically prepared, but mentally and emotionally equipped as well. Peer support is a powerful tool in this regard. It allows professionals to share experiences, learn from each other, and provide emotional support. After all, dealing with combative patients can be stressful and emotionally draining. Having a network of colleagues who understand what you're going through can make a world of difference. Lastly, access to mental health resources is another essential component of support. This can range from counseling services to stress management workshops. These resources help healthcare professionals maintain their own mental health, which is just as important as their physical safety when dealing with combative patients. In conclusion, proper training and support are the backbones of managing combativeness in patients. They equip healthcare professionals with the tools they need to handle these situations effectively and safely. They provide a buffer against the emotional toll that these encounters can take. And perhaps most importantly, they ensure that healthcare professionals are able to continue providing the highest level of care to all their patients. Training and support are vital for healthcare professionals in managing combativeness in patients. So, what have we learned about combativeness in patients? We've delved into the complex and challenging world of combativeness in patients, unearthing the causes and exploring real-life case scenarios. We've come to understand that combativeness isn't a simple one-size-fits-all condition. It can be induced by a multitude of factors, be it delirium, psychiatric disorders, or even certain medications. We've seen through our case studies how these different causes can play out in real-life situations. Our first case study shed light on delirium, a sudden and severe confusion that can lead to aggressive behavior. This is often a reaction to a medical condition, substance withdrawal, or even a side effect of certain medications. Our second case study took us into the realm of psychiatric disorders. We've learned that patients with conditions like schizophrenia or bipolar disorder may display combativeness as a symptom of their condition. Understanding the underlying disorder is key to managing such behaviors. In our third case study, we navigated the tricky waters of drug-induced combativeness. We've learned that certain medications or substances can alter a patient's behavior, making them aggressive or combative. Recognizing this cause is the first step toward resolving the issue, but understanding the causes is just the beginning. We've also discussed strategies for managing combativeness in patients. From de-escalation techniques to therapeutic communication, we've explored different approaches that can help healthcare professionals deal with these challenging situations effectively. Yet none of this would be possible without proper training and support. We've underlined the importance of equipping healthcare professionals with the necessary skills and knowledge to handle combativeness. This not only ensures their safety, but also contributes to the patient's well-being and recovery. By drawing on these insights, we can better navigate the challenges of combativeness in patients. It's about understanding the person behind the behavior, the factors fueling their aggression, and the strategies that can help diffuse the situation. By understanding and effectively managing combativeness in patients, healthcare professionals can ensure the safety and well-being of all involved.